Hello. Should I go ahead and kick off?
Hey everybody. I'll go ahead and get everybody started. I'm going to be moderating this session. Tara Rutley. So we'll go in order. I want to make sure. Let me just scan across. I'm not sure. Let's see. We've got. I want to introduce our advisors or our panelists for today. First, I want to make sure that we've got David Radznowski. Rad's in the room from the ISS National Lab. Hey there. Thanks for joining us.
Yeah.
Then we've also got Woody Bibb from Bob Ventures. Let's see, Woody. Is Woody here yet? Scanning, scanning. Not seeing Woody yet. Give Woody a minute. If you're here, Woody, and I'm not seeing you, just speak up. You might want to give Woody a minute to join us. And then we've got Emmanuel
Hey
Uriqueta.
Tara, how are you?
Hey, good to see you again. Yeah.
Good to see you too.
From UCF, University of Central Florida. Living the best life out in Florida. It's staying warm. I hope, while everybody else is a little bit cold around the country right now.
We've used the
Uh,
snow over here. Yeah.
yeah, Houston's getting it, you know.
Oh yeah.
You're missing an epic event.
Yeah.
And so we'll go today for a few hours, and this will be the order. I want to make sure that we've got, just say yes. Let's take attendance and make sure we've got all the teams here. Just say Radical Shoots. Are you there?
Yes.
That's a yes, I think.
Yes.
Okay. Problem Solved Aerospace,
Yes, ma'am.
MedAire,
We are here. Hi, everyone.
Confident. Hi. Confident Good.
I'm here.
Great. So we have a little bit of the advantage today in our track is that we don't have a full session of presenters, so we can go a little bit over do your 5-minute presentation, and if there's more than 10 minutes Q&A for each of you, we can use that time. But as a reminder, there is a feedback form, so when you're listening to the team speak, we're going to open the Q&As open to the judges first, for as long as let them get their answers and suggestions out. And then we're going to open it up to general Q&A for the rest of you. And for those of you who don't want to speak, you're welcome to please fill out the feedback form that should have been dropped in the chat somewhere. There it is. There's that link. Thank you, thank you, Catherine. And one more check on whether Woody is with us yet. Okay, so we don't have Woody, but I think in the interest of time, we'll go ahead and move forward. Yeah, Catherine's nodding, so we'll do that. Okay, so first up, let's go with Radical Shoots. You have 5 minutes for presentation, and can you share your screen? Great, thanks.
All right. Let's see. Hello, my name is James Valencia. I'm the founder of Radical Shoots in Nashville out of Vanderbilt University, and we believe in food as medicine. Towards that end, we're offering nutrition as a service. So we're harnessing precision farming production and research to deliver nutraceuticals and elixirs that empower communities on Earth and beyond. So what is the problem with food as medicine today? Well, there's thousands of medicinal plants and fungi without adequate research. So the ones that do, like turmeric, well, the 1,000-year-old belief that turmeric can help reduce inflammation. It's been backed by Western studies now. But when I have a headache, where can I go to get turmeric that is high quality, like they had in the studies, as conveniently as I can get ibuprofen from Walgreens? Well, it doesn't really exist right now. There's resource constraints with traditional agriculture and infrastructure, and so we can't always meet diverse nutritional needs. This is especially true in extreme environments such as in outer space. What we're offering are elixirs, where these are made from raw honey, from precision farming products such as micro radish and lion's mane mushroom. Why these ingredients? Well, besides being packed with energy, raw honey, it's anti-inflammatory, antimicrobial, not to mention it has pretty much infinite shelf life. Some of these herbs and fungi, a lot of incredible research behind them. Radish, for example, reduces inflammation. It's been studied for anti-cancer properties. It may help play a role in supporting astronaut health when they have long-term exposure to high radiation. We have an existing supply chain here in the South. We're offering customizable grow-to-order remedies that are going to allow humans to thrive for longer durations and higher stress environments. The opportunity, if we just look, for elixirs at the global functional beverage market, which, we're entering this year with elixirs, it's growing rapidly at 125 billion plus. We're targeting health conscious consumers, but especially targeting organizations that have specialized needs in food and space. And so we're looking for partnerships with wellness and beverage companies, health insurers that can help subsidize the cost of this nutrition. And then, space programs that are interested in doing pilots. Why us? Well, CC Gardens, it's been going for, that's our chef sister company. It's been going for 15 years. We've been really continuously pleasing chefs, which if you've been in the back of a kitchen, chefs are hard to please. We also serve families every single week at our retail store. This morning, I dropped off one of our weekly deliveries at Vanderbilt University for all their student athletes, and we're getting in to the rest of the dining halls as well to serve the rest of the students. This year, we're putting in proposals to do a pilot at the Nashville General Hospital to be able to get some research with their cancer ward specifically in their food pharmacy, putting a hydroponic installation there and then being able to offer some of our products. We're going to be getting into some public schools as well, serving children with the Tennessee Farm to School movement. And then this year, we're excited to expand our footprint a lot at the Opryland Resort. They have these large greenhouses we'll be taking over to be able to supply their whole campus with really the highest end produce there is. We're also amping up our honey partnerships this year, and then we're testing our elixir mixes to be able to start mass producing those. Our team, I'm James Valencia. I'm an urban farmer. I have a background in environmental sociology and communication of science and technology. John, he ensures our operations are data-driven. He runs our e-commerce, which is newly launched at radicalshoots.com. Teddy, he is a master pastry chef, and he puts professionalism in all the value-added products that we're putting out there. He also runs our retail space. And then Ethan, along with Josh, they're both PhD students at TSU. They are our plant geeks, making sure that the research we're doing is cutting edge and that our production is up to snuff. What we're looking to do in the next 3 to 5 years. So we're developing a prototype for a bioreactor installation that can fit in a very confined space. And so that way we can have on-demand production and elixirs. And then using that prototype, we're hoping to be able to secure low Earth orbit contract to do a pilot, and then also get those installed in 3 additional hospitals. We're all the while going to be generating revenue, growing our existing sales channels and accumulating research. But what we're doing with this really is all this engagement and information. It's teaching us more about our product and how to deal with diverse sets of individuals in diverse environments. So we're looking for funding for key hires and equipment as our footprint expands. We're trying to get trials with space agencies, research institutions. So if any of those 3, thank you very much. Please reach out.
Well done.
That
Well done,
that must be
James.
like the Grammys, like Golden Globes when they kick in the music.
I guess so. That shocked me too.
Sorry about
But
that.
it takes the
I was
pressure
running
off
the
of me.
times. It just does that at the end.
Make
That's
sure to
great.
make sure to thank your mom.
Yeah, yeah. Well, that was really great, James. Appreciate it. You're right on time.
Thank you.
So for the panelists, do you have any questions or suggestions or thoughts for the team?
Yeah, I have a question for you. Um, and you may have mentioned it on slide, kind of like the business opportunity. I guess what would be your strategy? I know that you're trying to get space agencies and stuff like that on board, but what would you say would be your go-to strategy to kind of like, sell that point? What would be the value to say an agency like NASA?
Mhm. Well, if we can start to get some of the people training to be astronauts or on the campuses to start incorporating this into their nutrition program, then we can start to get qualitative and quantitative research on how that's improving their wellness. And then once we have a bioreactor that can be installed in a confined space, we can essentially send up raw honey, seeds. We're also looking at Oxmo style elixirs, so apple cider vinegar, and then being able to grow things within a confined space and then being able to mix them on site. And so that would really be the goal is to be able to have kind of a directed nutrition and also nutraceuticals that can help with not just preventative medicine, but also responsive in addition to nutrition.
Awesome.
Thank
Thank you for
you.
that, James.
Thank you. Woody or David or Emmanuel, any comments, thoughts, or questions from you?
Yeah, this is Dave.
Great.
So James, a couple questions. One, in terms of what you talked about, honey, elixirs, and that, do you know? I mean, I've been involved with the space program for a long time. Do you know if any of that is actually used by the current day astronauts in their food nutrition chain?
Honey is, I believe, but it's not mixed and it's certainly not grown like in space. So as far as what I can tell, there are two different precision farming systems on the ISS, but they're not being combined with honey in order to have longer.
Okay. And then my second question is in terms of your proposal, what is your biggest stumbling block challenge that you need to overcome for this to be successful?
The biggest challenge is because there's not, a ton of research on elixirs or specifically a lot of the microgreens or fungi that we're growing. Even if you look at the nutritional studies on amaranth microgreen, which is a complete protein. They're only studying one specific variety under certain conditions. So, last year, NASA started doing some research on microgreens, and there's really compelling findings. But, what we need to do is essentially get more trials going and then pairing that with humans that are consuming it to see the correlations with their wellness. And so that's why we're really excited about doing the pilot with the Nashville General Hospital, because that's the first time we can really work with health professionals in a clinical setting.
Thank you, James.
Thank you.
Thank you, James. This is Emmanuel. Really good presentation. Just I guess one couple of suggestions. I mean, I think your plan is good. As you think of commercializing this in space, you need to think that there's going to be multiple stations, with different providers and probably different standards on how you are going to use the bioreactor. So trying to make it as not, I guess my suggestion here is to make it as generic as possible, so you could use it in different spacecraft and different vehicles, not only low Earth orbit, but as we plan going back to the moon, and eventually to Mars. I think capability like this would be absolutely essential. And the second one is it's always nice to have terrestrial spin-offs, especially as a young company. I know that spaceflight is great, and I mean I eat and breathe and dream space all the time, but having other sources of income and support terrestrially, I think it's essential for a young company like yours. So think of terrestrial populations that have similar problems to spaceflight, isolated communities, remote areas, especially these days, even refugee camps and people who have to be displaced, during the war to other places that they don't have readily access to food or to nutrition. I think those places would be also very valid and useful to prove your technology and again to find additional sources of funding and support.
Thank you very much.
Yeah, James, this is Woody Bibb. Sorry, I was on the wrong track initially. So anyway, my background, I don't know if we're supposed to share it, but I came from the medical device background, started with Boston Scientific years ago in the early growth years, and then learned the clinical side of it and launching like intravascular ultrasound and then coronary stents with drug elution and stuff like that. And then now the last 15 years, been more involved in early commercialization companies. 3 of them been acquired by Boston Scientific. And one of the things I know working with them was early on is what's a good patient story, even if you don't have, do you have any specific data on patients now, or you're trying to create a specific story when you go to Nashville General, for example? How did you get that? And did you guys have a targeted audience yet, or you're in discussions of how that's going to look? Because I would like to hear a patient story so I can wrap my brains around it in not such technical terms.
Mm-hmm. Right now, we don't have any hard data. I mean, I have a lot of customers that we serve each week that can give, testimonials.
Mhm.
Uh, but the goal with the food pharmacy is, their food pharmacy right now is kind of a little bit dismal. It's just canned goods and very little fresh produce. So originally, we're combining with there's a cooperative we're a part of called Grow to Learn. And so it's workforce training and then also providing nutritious access to food. So they were going to be like with them, we're going to be installing that hydroponic machine, but then the microgreens is what we're adding on to be able to get specific targeted data because I know that their cancer ward works a lot with the food pharmacy. And some of these microgreens, there's incredible research about the anti-cancer properties. And so at the very least, we're going to be able to get qualitative data, the stories, but then, if we can get access to some of their medical records, that's where, people on our team like Ethan can come in to be able to get quantitative research on how it's improving their health.
Great. Can I ask a follow-up question?
Please.
So also, what about, I still like a story to help explain it. And even if it's anecdotal information with other patients you've already had and kind of shared, hey, this is why I wanted to do it. And that's why we're developing this. And
Yeah,
this is
absolutely.
thinks it'll help. So that's the reason why I make that bridge. It just,
I guess like to give two examples, like somebody, we've had women come in when they're on their menstrual cramps, and they have really terrible cramps, and the radish microgreen, they come back each month because it really helps reduce the cramping and it reduces symptoms. You have other people who come in with stomach issues all the time and they'll get digestion mixes. So these are like sunflower microgreens. These are mustard microgreens, things that have low fiber, that are very tender, easy to digest, and they're all absolutely pesticide free and herbicide free. And so it's the ability to be able to trust it, to be able to get some of the research behind it and to feel how it affects your life. The mustard microgreen, you can feel that in 20 minutes, so something like lion's mane, it's supposed to improve your focus. It may take a couple weeks for you to really feel a difference, but there are some microgreens and some mushrooms too that it's immediate. And I'd love to, if anybody is in Nashville, ever to come by our stand at the Nashville Farmers Market. We've got a retail store. It's a little greenhouse on site there.
I live in Nashville. I had C. diff last year, struggled for 9 months. I'm going to come see you.
Oh, please do. Every Saturday, Sunday, 9:30 to 4:30, sir.
Nice. I'd be there too if I were up here in DC. Thank you so much, James. That's the time for your team. Now we're going to move on to Problem Solved Aerospace. You got 5 minutes. Then we'll move on to Q&A. Let the timer start. Okay, we can see your screen, but if you're talking, we can't hear you.
Good morning, everyone. I'm
Morning.
Jeffrey Enser, CEO of ProblemSolve Aerospace, or PSA. I'm joined here today with my co-founder, Charles Moon. We're excited to share how we're pioneering astronaut safety and advancing space exploration with our flagship solution. Let's dive into the challenges we're addressing and how PSA is uniquely positioned to solve them. Our vision isn't just about technology, it's about impact. At PSA, we're driven by the mission to enhance astronaut health and safety, leveraging innovations that not only support exploration, but also improve life on Earth. Every system we create is designed with one question in mind. How can we solve the critical challenges humanity faces in the most extreme environments? Research supported by NASA's Human Exploration Research Analog highlights the critical challenges of inadequate cooperation, coordination, communication, and psychological adaptation within space mission teams. Transitioning between mission-critical tasks often leads to heightened stress and reduced performance, particularly during high-pressure scenarios. Without real-time, adaptive support systems, the lack of proactive monitoring and predictive insights can jeopardize both crew safeties and mission success. These risks are especially concerning for long-duration missions and future civilian space travel, where maintaining team cohesion and performance is essential to ensure successful outcomes and the well-being of participants. Introducing AstroHealth Space AI. AstroHealth Space AI is a transformative lifeline for astronaut safety and performance. By combining NASA licensed technology with our proprietary algorithm models, it enables real-time monitoring and adaptive responses. Wearable biofeedback sensors detect critical markers like stress, dehydration, and fatigue, while the system autonomously adjusts environmental factors such as lighting, oxygen levels, and temperature to optimize performance. Seamless integration with NASA's Lunarsor, or 911 for the moon, AstroHealth Space AI ensures reliable emergency communication in even the most remote conditions. This dual-use technology extends beyond space missions, offering solutions for monitoring high-risk projects like those aboard Black Star Orbital's Life Science Module, as well as applications in remote healthcare and disaster response. By leveraging NASA's advancements and PSA's proprietary innovations, AstroHealth Space AI sets a new standard for proactive health monitoring, redefining safety and adaptability for space and Earth alike. Our focus isn't just on innovation, though, but on sustainability and growth. With a projected $2 billion market in space-based health monitoring by 2032, PSA is strategically positioned as a veteran-owned government contractor to capture federal contracts and secure partnerships. But what truly excites us is the ripple effect, how our solutions for space can transform industries on Earth. Our journey is already underway. We're uniquely positioned to cut through red tape and deliver solutions faster. With phase 1 completed, including the development of a prototype and collaborations with NASA, we're leveraging technology transfer programs to integrate AstroHealth Space AI with Lunarsor and simulate it in an extreme environment by 2026. By 2028, we'll deliver a fully operational health monitoring system ready for deployment. What sets PSA apart is our ability to act now, not tomorrow. Unlike larger competitors bound by slower processes, we harness NASA licensed technology and rapidly integrate it with our proprietary innovations. As a government contractor, we leverage programs like the Small Business Innovation Research Initiative to fast-track development, secure critical funding, and demonstrate feasibility. Additionally, our status as a government contractor allows us to navigate federal processes efficiently and position ourselves for high-value contracts. Our team brings a unique blend of technical expertise and leadership. As a U.S. Navy veteran with a background in government contracting and NASA programs, I'm proud to lead the mission alongside a team of experts in engineering and data science. Together, we're not just building systems, we're building trust and reliability in the space ecosystem. PSA is at the forefront of rethinking astronaut health, safety, and mission success. With AstroHealth, we're solving today's challenges while creating solutions for tomorrow. I invite you to join us on this journey to push boundaries, enhance 911 on the moon, and unlock new possibilities for exploration and innovation. Thank you.
Well, thank you very much, Jeffrey. That was an excellent presentation and very timely. I appreciate that. And I think you have the right panelists in the room for this kind of technology between Emmanuel, David, and Woody. So I want to throw it to you all, you three first, on whether you have any questions or suggestions or advice for Jeffrey.
Yeah, thank you, Jeffrey. Very good presentation. I have a few questions for you. So in your first slide, you were talking about the HERA. Actually, I was one of the members there for 30 days, so I got to test a lot of the things that you mentioned there. You were talking about team, and I do agree that team dynamics and team composition is still a very challenging issue in human spaceflight, especially as we go back to the moon and Mars. We need to have the right crew. But then I didn't see how, because then on the other slides, you were talking about wearable sensors and you were talking about health in general. So I think I missed the connection between what you were talking on the first slide about team and then health. And then you also talk about behavioral because, those are significantly different aspects. So I was just wondering how, you measure team and health with the wearable sensors. So that's the first question. The second one, what are you doing to validate your wearable sensors with other type of sensors that have been utilized already?
Yeah, and thank you for the question. For your first question, you asked about, I guess, the health and the team, right? But I think that, I mean, we can take a step back and look at human health, right? If you're working on a team and your team member is not well mentally, right, but you guys still have a job to do, that's going to affect your mental health, right? Because now all the tasks that you're assigned with, you have to pick up his load. So I guess with the behavioral aspect, this system is able to monitor your biofeedback and make necessary adjustments to your surroundings, and other things to make sure that you're able to complete the job. Um, as far I don't really, and as far as like the mental aspect, I guess I guess that's all inclusive to the team, right? If somebody's not well on the team mentally, let's take a spacewalk, for example, right? That's a team exercise, right? Maybe somebody is doing it, but there's other people monitoring it, and maybe even people on the ground. So you want to ensure that, those people are of the right mind at the right time. But say in the event that, something happens during the spacewalk that they can't control, that's outside of their control, this device essentially will allow them to essentially have that control, or make their astronaut suit more comfortable for them, whatever that looks like. Does that answer your question, or are you still needing me to connect the dots?
I think that helps. Thank you.
Gotcha. And then you're saying, what are we doing to validate? Well, the cool thing about, new technology like this is we're just starting to validate that, right? So we have several proposals in with NASA right now to validate that information, right, against current HRP data. I can, speak on that briefly. We do have this application geared towards an HRP proposal so that we can gather that information and, fine tune the proposal and actually, present that as facts, because we're still at the beginning phases. We have an ideation and we have a prototype. We wanted to do it hard and, go for NASA, right at the gate. So, but that's just part of, doing things with organizations like that. You kind of have to go through the process and continue to validate it. I don't, realistically, I don't think that it would be something that would be sent to space maybe in 2 years, but essentially a system that could be improved later on, and then improved, applicable to space stations. Even, Blue Origin space station, a prime example. Imagine you're in the space station and you have this device, and the device detects that you are suffering a heart attack or something of that nature, and it adjusts the lighting, or adjusts the amount of oxygen that's coming into that particular module on the space station to circumvent what's happening to you. I think that that'll be something that'll be crucial as we kind of move into this, continuous cadence of, sending people and objects to space.
Thank you, Jeffrey. And last thing, just a suggestion also to look at other uh, scenarios on Earth that have similar problems. I see in your description that you are a Navy veteran. First of all, thank you for your service. But the submarines, the submariners communities, they have very similar problems to the ones in spaceflight, especially also team dynamics and team composition. So you can look at places like the Naval Submarine Medical Research Lab. That might be another, because as you said, it's difficult to test things in spaceflight. So testing it in terrestrial populations would be also useful. So maybe look at those ones as well. Thank you, Jeffrey.
Awesome, Andrew. Thank you for that tidbit about, the Navy. I didn't even think about that, but now that you mentioned that, makes sense. So thank you.
Yeah.
Hey, hey,
This is, go ahead, Woody.
oh, thank you. Hey, Jeffrey, this is awesome. Great presentation, and it fits well with a team that I took that was part of mentoring at I-Corps last year at Vanderbilt in being able to detect stress in real time. Tell me a little bit about what's different about your wearable and being able to detect stress versus like what's available with an Aura and an Apple Watch. How are you differentiating that, and what are all the different metrics you're testing?
Yeah, so I would say that it's, all the NASA proprietary license software that we're using behind them, and that system that they're using, right? So, NASA's identified this as a system that works, right? So I think what separates us from like a Fitbit or like Apple is a space application. That honestly is like the biggest difference. And then, I try to tell people there's a glucose monitoring that just came out. What is it, Stuco or Stevo? It's similar to that, right? But we're just changing not the metrics, but the baselines that we're measuring. So we're not, looking for blood sugar levels. We're going to be targeting heart rate. Maybe I don't know how to detect like confusion, but eventually we would like to build something in there where it's able to detect uh, like brain health. I don't know what that looks like, but something in that fashion. And then from there, we'll have an interface that, adapts to that and will change, to what we set it to eventually. So that's what I think would be the biggest thing is we're not is the adaptive nature to the device, right? Is with Fitbits, you're just tracking what you're doing. Okay, hey, I ran 60 steps today. Tomorrow I got to do 80. You are taking that action. This device will integrate again with the environment, and again, it's massive. It doesn't have to be just astronaut health. This could be on a space station, and then changing the environment to what's going on for you. So that's what I would say would be the biggest differentiator in kind of like Apple or Fitbit at the current moment.
Well, awesome. I could totally nerd out with you on like some of these conversations later, but I won't bore the group with that. So,
Oh, well, feel free to, if you
yeah.
guys didn't, please scan everything in here. That's direct links to me. Here's the white paper. On the last slide, there's a direct link to me. So yeah, feel free to get my contact information and, reach out. Thank you.
Love what you're doing.
All right, 3 more minutes, Dave.
Yeah, I actually the answers to some of these questions help me a bit. As a prime user of an Apple Watch that's following my health, since I have AFib and high blood pressure and everything. I mean, there are applications out there that tell me where I am in terms of my vulnerability health-wise, my energy, my stress, and gives me advice. So I understanding what you're talking about. I just have a question on the business case. Given that the astronaut environment and the number of astronauts, it's such a small demand for this. I was thinking submarines. I was thinking mining communities. I'm just trying to understand why are you going after space versus some of these other activities, which would have a much broader market?
Gotcha. Well, and again, I know that I mentioned this. We do have a dual use application, and we do understand that. I think again, NASA, just because I do a lot of stuff with space, was kind of like what I wanted to target first. I did complete NSF Corps the last 3 months, and that's what we learned, right? Is there is this other kind of base, and that's something we'll work over the next 6 months. But I think too, and what'll be helpful, and I can share this with you later, is the actual like system and method that the patent holder has. It's so much more than that, right? And you do bring up a good point that astronauts are only far and few between, but this technology would make that so they aren't far and few between, right? So NASA astronauts, right, are the cream of the crop, right? When NASA decided to do the Challenger missions, they realized that they didn't have to have everybody being a pilot. They realized that everybody could be different, have different backgrounds. The same is going to be for future space travel, right? If we're going to continue to, push into, Mars, for example, it's going to be regular average Joe. So we're going to have, a health monitoring system that is all inclusive that can make decisions on behalf of the human for themselves. So, to circle back to your main thing, you're right. It's not a big thing, but I understand the dual use of the technology. Again, another prime example I'll bring up is, Black Star Orbital. You guys will maybe speak with them. They have life science modules. This same technology can be applied to real life, science modules or technology being monitored, right? Or even Blue Origin's orbital reef, so. I understand that it's kind of niche, but I think that, there's again, like Emmanuel had mentioned, there is other needs for it in the submarine community. I just have a passion for space, and that's just what I wanted to shoot for first.
Okay.
Thank you.
Thanks, everybody. With that, that's 20 seconds left. So I think it's probably best to move on to the next team because we can't get anything done in 20 seconds worth of conversation in here. It's going to take longer than that. So thank you so much,
Thank you,
PSA and
everybody.
Jeffrey. We appreciate it.
Thank you.
All right. Next up is MedAire. Who do we have for MedAire?
Hello, Tara. This is your representative management team for MedAire in the room, and that's led by Jody Ash, and then John Coffin and myself, Chris Bigger. Thanks for having us today.
Hey, thanks for being here. Let's go. Let's hear about it.
Yeah, we are working to share our screen here, so someone else is still sharing. Sound, share sound. There we go. Whoops. Clearly, we jumped ahead.
At least we can see your screen.
There you go.
And hear you.
All right. Video first, Rick.
Yeah, do you want to start?
Yeah. So the MedAire presentation is probably a bit different because we are pretty well established within the private and commercial aviation industries as they are today. And is what we're looking to do is expand that reach, into the space markets and make sure that we're identifying the right folks within the segment to help us evolve our existing solutions. With our 40 years of experience, we do have a diverse and proven risk management solution for health and security, and even remote diagnostic and medical equipment.
Sure, you know. Hopefully you'll all be able to hear the actual audio here.
At any given time, there are between 1 and 4 million passengers traveling by air. Medically speaking, what happens in the sky is a subset of what happens on the ground. I'm Monish Bao. I'm a physician with MedAire's MedLink. We are located at the Banner University Medical Center in Phoenix, Arizona, and are available 24/7. At MedLink, it is our job to help the first responders in air navigate a stressful situation. We typically receive between 400 and 500 calls a day. They range from common occurrences like food poisoning and simple fainting spells to more emergent and life-threatening conditions like stroke and a heart attack. Our customer service executives will obtain critical information from the flight to pass on to the physician. The physician then will also speak to the flight crew to obtain additional information, as well as review the medical kits that we have available on board. In the event we deem a medical condition to be life-threatening, we may consider diversion. Our logistical crew on the ground will help assist to arrange for medical assistance on the ground, as well as to ensure the safety of the other passengers and crew.
Okay. So based on the assumptions that we have today, as space travel becomes more prominent and more frequent, we'll likely see a lot of the same passenger issues manifest, the medical conditions that experience both pre-flight and in-flight, and then require a better understanding of how we do those or how we handle those in the space environment. So the problem is that we see commercial space travelers and providers have a lack of medical support for the things that they may need. And as we look to the future, we realize that it's not just limited to the vehicle itself. Tara, you mentioned the ISS and the evolution of that going forward. What needs are there? What partners are in the industry that could take the expertise that we already have in place to work together and find the appropriate medical solutions, not just from a training aspect, how to respond in that environment, but also what medications for prolonged service and shelf life, and then also which type of diagnostic tools, right, would be beneficial to have either on the person or available to be able to have the real-time medical support with a physician. So our next steps in all of that are the test and evolve solutions that we already have in both micro and zero-G environments, and then collect and analyze the data in various flight configurations. So all the things that we've learned throughout this very awesome program, all the different environments, but truly forming partnerships and understanding what the real need is going forward. So yeah, the ask. Would love your feedback. Would love to communicate with you and answer any questions that you may have about us.
Okay. Thanks very much, guys. You are under time by 40 seconds. So I'll turn it over to Emmanuel, Woody, and Dave for questions for this group.
Thank you, John. Really good presentation, and that's great that you guys deal with most of the aviation medical conditions. That's great that you guys provide that support. So two questions for you. You mentioned in one of your slides lack of medical support, and I guess by that you were meaning both from a training, but also from an equipment perspective. And then on your other slide, when you're talking about using zero-G flights and microgravity, what specifically are you planning on testing there? I wasn't sure. I didn't see any detail on that.
Yeah, so there's a few things, and I think the first answer that we have to talk about, when we talk lack of medical support, and we talk about the frequency of commercial space flight. Right now, everybody is very well vetted. I see some of the stickers and patches hanging behind your wall for the folks that have traveled to space, right? So we know that they've been well vetted medically, but we're going at some point to transition to the layperson. The layperson being in space that doesn't know how to respond, right? So what does that look like is how do you in these zero-G, micro-G environments respond? Someone gets sick next to you, if someone needs chest compressions, if someone needs staff medication, and how do you communicate to really dive into the medical scenario that they may be facing?
So that's what you were proposing, testing in microgravity and zero gravity?
Yeah, that's really where we would need to be now, would be how the existing solution works, and then to see what feedback we could receive to change it further.
Yeah, I mean, to be honest with you, a lot of these things could be tested terrestrially. I mean, going to zero-G is challenging and expensive. So usually, down selecting what you really want to test in zero-G, like, if, say, a device that has never been flown to space works in microgravity, but really a lot of the logistics of how to work in a small environment could be tested, terrestrially in a small room or a sim lab that will help you to really focus what you really want to down select to test in zero gravity. And space station and the new stations that will be on low Earth orbit, they will have the luxury of having pretty much real-time communications like we have with ISS. So telemedicine will be available the way that you guys do it with the commercial aviation. But as we plan missions even back to the moon and eventually to Mars, telemedicine is definitely not going to be a capability because of the really big distance. On a mission to Mars, we're expecting 40 minutes of time delay communications, right? So looking at AI and really automatic AI-driven decision support is what's going to be needed for those missions. So looking on the data that you have, because I'm sure that you have, probably one of the largest databases on how you have solved medical conditions in airplanes, how you could use that data to train autonomous medical decision support for that missions. I think that would be something that you could also explore with your data set.
Oh, that's great feedback, Emmanuel. Thank you for that. And the AI driven, it's definitely something to look into. I think if we look at some of the medical devices, that we would have concern with that operate terrestrially, but may not so much in space, as we do have, what is functionality of an AED? Again, thinking about the layperson, what risks are associated with that in that environment, and even with the diagnostic tools that we have today, 12-lead ECGs, all of those things. We know how the body responds at altitude, right? And with gravity, but what will it be like in those environments and those tools? But no, that's all very good feedback. Thank you.
All right, Woody or Dave?
Yeah, first I like the video because it just kind of gave me a good idea of what you working on. It gave a good story. Also, what does your discovery process look like so far in terms of what are solutions that are being used now? What gaps are there that you can still fit? Or are you still kind of working on exactly what those needs are and how you're going to differentiate?
Did you want to speak to that, Julie?
No, I think we are still working on trying to figure that out. We've had some initial discussions, and we've done some initial work with a couple of different companies. However, it's all on the ground work, medical support on the ground for perhaps the recovery when they're returning. So, or supporting on the ground before a actual flight takeoff or whatnot, or launch. So we haven't done much, I would say.
Oh, that's fine. Is that part of the ask then?
Yes.
So it's kind of the help
Yes.
in terms of really a discovery phase to
Yes.
help which
flesh
direction.
out. Yes.
Yeah. And I think a lot of our limitation too has been within, regulations. We are guided by the FAA and global aviation authorities, and what we're learning right now is that there's a whole lot to be written out there in terms of the space regulation and what we need for compliance.
Great idea.
Okay, David.
So yeah, I had a couple. So one, I love the concept of we have something that works, we have the experience, we're looking for future applications that may be applied to space. I'm a space geek, but yet I always like folks to do all their testing and thinking on the ground. The availability to do testing in space, the amount is just so expensive and hard. To be able to test it out, like you said, city pairs, parabolic, maybe there'll be some suborbital flights that you'll be able, flight opportunities you'll be able to take advantage of. Those are ways to really test out your concepts in that. And I just think of so many terrestrial ones, I'm sure you've thought of these, that, I'm a guy that likes to go backcountry, right? With my wife, and neither of us is medical. And usually we don't have service, but we might someday with Starlink or something like that. To be able to use this for those type of expeditions, whether it's groups and that, where when a medical emergency occurs, most things that are real big emergencies, you need to react immediately. It's the reason we go to level 1 trauma places if you have a stroke or something like that. So to be able to do something like that and prove it out in the earth, to me is definitely a way to go. And then when you get opportunities to do a parabolic flight or a suborbital, and you start to see how that might be applied, you basically are able to then show, hey, we've proven this out. Now let's talk space versus let's talk space first. And I really appreciate that in the way you're thinking. So that was what my biggest reaction was. I like the way your business plan is put into place.
Thank you, David.
Yeah, and if I could just add, thank you, David, Woody, and Emmanuel. You mentioned, and we've already gotten some indication through the Space Edge program that there are ample opportunities. Because I think when we first went into this, we had the assumption that we were going to have to spend a lot of time, energy, and resources testing in actual micro G and zero G. But as we learned, there do seem to be ample opportunities to simulate in a terrestrial environment, maybe even some real world testing, whether it's in partnership with a university lab, a private sector organization. That's really where we want to try and explore a little bit more, because obviously R&D, you have to control those expenses. You have to prioritize. You have to figure out where do you want to focus those energies. So that's all exactly to your point, gents. That's exactly where, if we could, we would be grateful to get a better steer on where can we go and start to do a little bit more refinnement in understanding how do we take some of the concepts, maybe even some of the equipment that we have today, maybe work on starting to develop some prototype. Where would be the best places to go for that? That's where I think, I don't want to say struggling a little bit, but we learned that that's where we really should be starting. That's the starting point.
And I have some thoughts on this too. NASA is the gold standard for health in space and going through, they know what works medically, operationally in a microgravity environment. But what they know is for the very highly selective group of government astronauts whose medical background is very clear. So there's a specific number of scenarios that they are trained for in practice and know the ops. And then when you think of something like orbital reef, where it's more like the people you deal with every day on the airplanes, that expands out further, that maybe NASA's not had to think about that or practice or operate, maybe not, right? So when you think about your parabolic flights or your Earth analogs for space, it would be the general population expanding to people like you and I that you would be specializing in, I think.
Yep,
Yeah.
absolutely. And we have 40 years of a data set, as I think Emmanuel
right.
kind of indicated right now, but for aviation in a terrestrial setting, the question then becomes, is there anything that we can do with that? And then how do we marry that with future data sets, a different environment, et cetera, et cetera. So absolutely, because
Yeah.
we deal with we've helped give birth to children on airplanes, and
Right,
we
right,
dealt with death on board. So
right,
it's like the entire spectrum. Yeah.
right. Yeah. Appreciate that.
Thank you, team.
Fantastic.
Thank
All
you.
right, guys. Thank you so much. Time's up on this one. Great, great, great conversation. Too bad we have to move on. But the good news is we're moving on to Confident Good. Where are we? Confident Good.
I am here.
All right.
I'm going to share my screen now. Let me know when you see it. Are we there?
Not yet. It says Scott. Oh, there it is. We got it now.
All right, very cool. Okay. So, hello and welcome. My name is Nikki Velez. I am the founder and CEO of Confident Good, a biotech company on a mission to persist good health. Now, what do I mean by that? What does it mean to persist good health? Well, simply put, our aim is to target the tendency of humans to get sick or injured, which is often a result of simply being alive, of moving, of experiencing. We want to turn this tendency towards medical suffering on its head, whether here on Earth or in space. We envision a world where good health is the default, where things like aging or exposure to the extreme stressors of space have no negative long-term effects on one's health. By harnessing the power of understanding, intelligence, intellect, and therefore cognition, we are on a mission to eradicate medical suffering by developing cognitive systems that target medical problems in both clinical and research settings, whether here on Earth or in space. The problem we are solving for can be summed up in one word: access. On Earth, factors ranging from inconvenient scheduling to more extreme situations such as poverty or war often prevent people from getting medical treatment within a reasonable time, if at all. Medical offices are often understaffed. Organizations such as Doctors Without Borders are under-resourced. And even with access, the doctor may not be trained in the type of medicine needed, or may simply be unfamiliar with the issue that the patient is experiencing. In space, the scope of what can injure or make a human ill increases. The ability for doctors to attend space travelers in a reasonable time will become strained. If a doctor is unavailable on site, distance may prevent patients from seeing a doctor. And if telecommunications are down, telehealth may simply not be an option. The solution begins with what most people, including astronauts in space, are already carrying around in their pocket: a mobile phone. On this phone, the patient will have access to our app, the Virtual Primary Care Physician. The patient will sign up for a subscription and get immediate access to a digital doctor. That subscription will be paid for using any method commonly used today, and will use prices that are in line with existing telehealth alternatives. No need to wait for an appointment, no need to travel. What's more, the breadth and depth of what the digital doctor can do will increase with every software update and with every patient interaction. The patient will be able to connect to hardware in the growing market of smart devices that can carry out capabilities not possible on a mobile phone. This will include humanoid robots that can address more physically demanding situations. The long-term goal is to have a fully autonomous digital doctor that can attend to humans in space. Getting there will require several preliminary steps over a 5-year period. First, we'll need access to as many patients and as much data as possible. Given the relative lack of medical spaceflight data, this means that we must begin by addressing a terrestrial market only, beginning with software-only capabilities and gradually supporting physical add-ons. Second, the virtual primary care physician will begin by serving as an intermediary between patients and human doctors, slowly taking on more and more medical care responsibilities in both clinical and research settings over time. Developing the virtual primary care physician will involve challenges common to the space and medical industries, such as meeting regulatory requirements and avoiding lawsuits. I will be leading the team through these challenges, drawing on my extensive experience with technologies, including artificial intelligence. Where we go over the next several years will be dependent on what we learn during customer discovery. With this in mind, I am asking you, the audience, for any introductions that you can provide to doctors and medical organizations, anyone that will talk to me, that can help navigate this journey towards the eradication of medical suffering and towards the persistence of good health. With that, I thank you for listening and open up the floor to any questions that you might have.
Okay, thank you, Nikki. All right, gonna turn it over to Emmanuel, Woody, and Dave.
Thank
Could
you,
I
Nikki.
ask, who would you like to specifically, like physician introductions? What particular type of physician would you like to talk to and why that group?
So I would like to start with just basic general practitioners, so primary care physicians. And the reason for that is the virtual primary care physician is intended to start with breadth and rather than depth. So I want to be able to capture as big of a market as possible without having to go really in depth when diagnosing or troubleshooting whatever medical condition it might be. I don't know if that answers your question.
No, it does. I would challenge some of that. Just in, for example, an interventional or a cardiologist, since they work with so many, with heart rate. There's a lot of tools they already have and apps that help provide them guidance in some of their treatment. And there might be some gaps that they may have that you might be able to solve. That's another reason why I say that.
Sure. Yeah, and that makes absolute sense. The long-term goal is that this digital doctor would be a doctor that you carry around with you as you grow. It can address whatever medical need you have. In fact, in space, it's intended for space long term. One of the major medical problems are, with the heart conditions, right? The heart, there's no gravity, so it loses its shape, and the flow of blood, all that gets affected. So it absolutely makes sense to talk with a cardiologist, and I'm definitely open to doing that if that's, someone that you might be able to connect me to. Sure.
So Scott, this is Dave. Just a question. I mean, this is not my area of expertise, but I'm aware there's a lot of people trying to do this.
Sure.
Even my brother-in-law, who's a neurosurgeon, is thinking about how he could do this within he's at DCU. So what is unique about, or what expertise or patent or license that you have that is unique, or what is your up compared to? My assumption is everybody's going to try to do this. I mean, I have Dr. Google is my virtual assistant. So what is what you bring to the table that's unique and different?
Well, right now, to be honest, the differentiator that I'm focusing on is the long-term strategy of being able to support astronauts in space. Um, I won't be starting with that right off the bat, simply because there's not enough data to support a model that can do that in space. So I'd have to start with terrestrial data. So to answer your question, I don't really have a differentiator here on Earth terrestrially. The long-term play would be that this is something developed for NASA for the space station.
Okay. So then, I'm trying to, if you're focusing on the unique aspect niche of the astronauts, again, you're bringing your background experience and trying to apply it to the space environment. want to understand how, that is again unique compared to what other universities or NAB itself is doing right now. What's your in the space community?
Sure. That's a good question. I wish I had
Other than this accelerator.
I wish I had a good answer for you. I really don't. I think what I'm trying to do is I'm just trying to connect to as many long-term thinking technologies as possible. Like for example, one of the things that I'd like to do is I'd like to be able to tap into the oncoming trend, if you will, of humanoid robotics. And this would simply be a brain that they can tap into to conduct whatever medical services they would be providing. So I mean that's as best as an answer that I can give you. I really don't have anything better than that I can offer.
So Scott, I also agree with David. David mentioned that this scenario where there's millions of dollars in investments already, so you need to have a key differentiator, that something niche that you are doing that the others aren't. Because even in the context of spaceflight, I agree that spaceflight is a different application, but the way that disease presents in space, it's not very different than the way that it presents terrestrially, right? I mean, the way that you're going to diagnose a medical condition is likely the same way that you would diagnose it terrestrially, maybe with a different equipment, not with, all of the things that you have in a hospital, but the condition is going to present pretty much the same way. So I would advise to find that key differentiator, even terrestrially, right? Because space is just an application. It is not necessarily so different than finding it terrestrially. Because you focus on that, even say that you get access to all of the data that NASA has, from LSD and LSAH, probably you're gonna find just a few hundred data sets, right? And that's not enough to train an AI system for a myriad of medical conditions. So I would suggest to look terrestrially, and then once you have that fully validated, just adapt it to spaceflight. Those were my suggestions.
Sure. Yeah, I appreciate the feedback. It's something that's been on my mind for a while. I just haven't found something that I can specifically point to and say, hey, this is my thing. The thing that separates me from everyone else. So it's something that I'll definitely be looking into. So thank you.
Okay, we have about 3 more minutes. If anybody else has any additional questions for Nikki or comments.
So a question I have is, in terms of connections with the space medical community, do you have those connections? Are you looking for those connections?
I'm currently looking for those connections. My next step over the next several months is going to be to start doing customer discovery. So basically, reaching out to any doctors that will talk to me, and just kind of getting an idea of what things make sense and what things don't.
So, and I think that's a great call on the discovery piece. Do you have a plan now? So, for example, let's say you have a GP that you want to talk to. Do you have a list of like 10 questions that you would ask, and then how would you record that information and keep up with it? Have you kind of started that process, or are you looking forward to even building that process to see what you need to gather?
I don't have a list that I would ask. I would kind of just my strategy would be to go in and ask very open-ended questions. Talk to me about your day. What kind of things do you generally do? Walk me through what you have to do when you're diagnosing a patient. Somebody comes into the office. And basically just observe that timeline, look for pain points, and see if there's anything that I can provide of value to solve those pain points.
Let's start now. Hey, Nikki, it's Jody and John and Chris with MedAire. We might be able to help you a little bit if you want to connect separately. We have a whole team of doctors and medical professionals Our Dr. Paulo, who's participated with us but not here today, is a cardiologist, so we might be able to give you a little bit of help and input if you want to connect separately. Yeah.
Sure, that would be great. I mean, I was listening to your presentation and I'm like, hey, this is like you guys are doing a lot of the stuff that I would love
Yes.
to be able to tap into. So yeah, I'll reach out to you after this meeting.
Okay.
Send an email to your team.
All right,
I
perfect.
appreciate the invite. Thank you.
Sure.
And we have 30 seconds left. The question from Susan, I see a hand up there.
Oh, hello. 30 seconds. Okay. So the bad news and good news. So I think you're a bit late in the game to try to develop from ground up a digital app for space, a digital doctor. Hi, Emmanuel. But the good news is there are ways to navigate with whatever assets you have right now to be able to work with organizations or entities like ours. We've been working in tele-avatars, avatar medic in space, and for nearly since 2019, right? So converging technology, even humanoid robots now, we're working with them, bring that in. So if you want to reach out, and if you want to reach out to us as well, then obviously we're very well versed in working with a lot of organizations in space medicine and building this platform, because we see even at 2018 we saw the future. So all I'm saying is, don't be disheartened. But I definitely agree with what Emmanuel was saying as well, is the analog community, especially in high fidelity, could be a place to start. So I know that was more than 30 seconds, but there's a lot more. But if you want to reach out, maybe we can help you in that way.
Okay, sure. I appreciate it. Yeah, definitely. This is all great feedback. I'll reach out to you as well. Hopefully we can get some good action items out of that.
That's great. Thank you, Susan. And I should say this ends Nikki's presentation time, but as you all are aware, we still actually have availability. What I think I'll do is the next session starts at the top of the hour. I'll be moderating that one. It'll be a whole new set of presenters. And we have between now and then I'm just going to leave this open so that those of you audience would like to ask questions of those that you saw present today. If you want to take some time or take a bio break, I'm going to propose we just leave the channel running here. Do what you need to do with this time until we all come back, or I will at least be back at the top of the hour. But I think that's it for Dave and Woody and Emmanuel. I think unless you all want to stick around for the next 30 minutes to chat, if anybody needs you all three, raise your hand or get them now before they go. But
yeah, so I would just offer for those that, as you know, I'm not a technical guy, I'm a bureaucrat, but I chair the Space Station National Lab Board, and those of you that are interested in connections to go off, see who might be the right people to talk to, I can connect you, or they're very easy to connect online through their web, and just talk to folks about their experiences, because they're the ones that are testing these type of experience on station. They're having competitions. What is it that they fund that makes it through competitions, like access to the space station to do your research? I think they're a great resource that is available to everyone from a United States perspective. So feel free to contact me. I don't know where our contact information I can put in the chat, but I really encourage you to talk to the Space Station National Lab folks, because they can give you ideas of, they've seen all of this at some point somewhere, of what might not work, what direction to go, or go talk to these people. I think that'd be a great resource for you all.
good suggestion.
Yeah, and I put my email in the chat, so same thing. If I can help with any connections or have any other questions, I'll be happy to meet with you. And great presentations, and thank you, Tara, for running the session. It was very productive and really enjoyed it. Thank you.
And Catherine reminded me that we do have a wrap up on this session in about 10 minutes. Well, in about 3 minutes, right? Right, Catherine? Is that right?
Yes, but I did hear that the other track is running about 5 minutes late. So I think
Okay.
5 minutes, yeah, at least in Mountain Time, it would be 10:35. You
Okay.
can translate that to wherever you guys are.
Yeah, thanks.
So as the
Okay.
advisors, do we need to fill out these forms before the end of the call, or can I do it in like 10 minutes?
You can definitely do it in 10 minutes. Yeah. Feel
Okay.
free. Yeah.
Hey, I thought it was a great collection of advisors. I learned a lot from all you guys. And I also like that you had such a diverse group that had different skill sets. And then all the presenters, oh my gosh, our country is in good hands. It's a lot of great stuff you're working on.
Well said.
And Tara, I'm probably missed the first 5 minutes of the intro. So what forms is Woody referring to that we need to fill out?
In the chat, Catherine's dropped in a link to a form that gives feedback, additional feedback to each team if you have it,
Oh, okay, great. Okay, I see it. Thank you.
if you'd like to use it. Yep.
Perfect.
There you go. She dropped it in again.
Yeah. There's that link. Yeah, feel free to fill that out, anytime, maybe in the next day or so that you can.
Okay.
And then we'll be passing that along, all the feedback to the teams.
Great. Thank you, Catherine.
Thank you, everybody. Okay. Bio break until 10:35 Mountain. And then I guess we jump back to the original room.
Yeah, you can just hop out of this breakout room, head back to the main room. And yeah,
Okay.
we'll get started with the next part.
All right. I'll be muting camera off here.
Thanks, everyone.
Thank you.
Yeah, thank you, everybody.
Thanks. All right. There.
Yeah.